So we'd like to introduce the second plenary round, and to introduce the speaker, it will be Dr. Alvin Chang, who's the president of our Singapore Paediatric Society.
Thank you. It gives me great pleasure to introduce Dr. Daniel, Professor Daniel Tsai from the National Taiwan University College of Medicine. Just looking at his, brief bio sketch here. He graduated from the National Taiwan University College of Medicine. Thereafter, he has involved himself in a lot of bioethics work, both nationally and even internationally, in his capacity, as a UNESCO chair for bioethics. And again, there's a lot of research work also being done in the area of research ethics, clinical ethics, cross-cultural bioethics, and of course, medical ethics education. I think it's really apt that he's up here to speak to us, particularly in this part of the world, looking at the Asian values, when it comes to medical pediatric decisions. What's the landscape like, and to what extent, respect for autonomy, is given in this part of the world. Professor Tsai.
Thank you, Alvin, for your very kind introduction. And I also like to thank Roy, Julian, and the organizing committee for giving me this honor and pleasure to come back to Singapore. I remember long ago when the Center of Biomedical Ethics was founded, I actually had the pleasure and honor to join the first a few international conference. And for the past probably 10 more years, I can see the growth and the very hearty participation for the activity and conference in the center in Singapore. So really a chance for me to learn a lot. And today I was given this challenge to tackle with pediatric ethics in terms of the Asian values. So in my speech, I would like to touch upon the global ethics debate firstly, and then try to find some resources that might be useful for our solving this problem. And then I propose some thesis of myself to see if we can understand this issue more. So before I start, let me tell you an old joke. Okay, I probably learned many years ago. When I was first time participating in the international conference in Tokyo, and Julian and I was first met at that time, and we were much younger at that time, and we are now both middle-aged uncles. Okay. So the story goes like that. In a UN activity, a teacher asks a question to children from around the world. Please talk about your personal opinion regarding the food shortage problem in other countries. Okay. And on reading the question, the African children do not understand what is food. European children do not understand what is shortage. And Asian children do not understand what is personal opinions. And Latin American children do not understand what is please. And American children do not understand what is other countries. Okay, you like that, okay? And if this story is true, or partially true, then it will be quite challenging to talk about pediatric ethics in Asian value today. Or we can say that it could be very promising because we have a lot of things to discuss and work to do. So let me go back to more fundamental questions, okay? As whether the global bioethics is possible, or should we do any adjustment or transformation when we are importing the Western expertise of bioethics into other parts of the world, like in Asian countries. So we know that in the past half a century, the medical ethics transformed radically. And we are all familiar with all those bioethics principles, okay? And then through modernization and globalization, the moral values of human rights and democracy and the principle and concepts of modern bioethics from Western society has transmitted and influenced non-Western countries. So we are familiar with the four-topic method or the four principles. We quite often teach them in the master program or in the clinical ethics consultation training course. And then there's a fundamental question where it goes like that. When the bioethic method has been developed in a certain biotechnologically advanced society can be utilized or transferred to other societies whose ethos, religion, social and cultural background, as well as the characteristics, perception, and nature of bioethic problems are different. Okay, so for example, I think when I was much younger, I was in my residency and I learned medical ethics from school and go to service in the world. And I find it quite some distance, okay? For example, imparting bad news. Okay, the family don't want you to tell the old people what happened. And signing DNR or discussing AD or advanced care planning is also difficult, okay? And terminating life support, like withdrawing NG tube, respirator, is even more complicated because you were told, oh, this might be illegal. And you have other issues like blood transfusion and organ donation. It also involves different religious perspectives. And lumbar puncture and complementary alternative medicine and gender issues. Okay, I think we will find all these issues quite challenging if you use what you learn in the Western textbooks into different contexts. So we can probably say that in scholarships, there's a dominance of the principle-oriented bioethics for a long time. And it is still quite often we teach them in our class, okay? We tell them lots of principles we should follow. And for example, this is based on Belmont reports and BGM Children's their publications. And then you have other scholars, okay, proposing different framework or different ideas. And let me just touch upon one, okay, this Downian and Common, okay? And this is from their book very early, okay? The book is called Healthy Respect. You see, there are principles of utility, justice, non-maleficence, compassion, justice, and self-development. But all these principles are governed under the respect for autonomous individuals. And this is the commanding principles. And the others, you can call them subordinated principles. So the framework, according to these two authors, I think an autonomous individuals, okay, bears the value why people should be respected. And there are other benefit should be fulfilled, okay? And then we will turn back to nearly a quarter of a century, a long time ago. So this was one debate, okay, when I was doing my PhD in UK, and it was at that time, people are discussing theoretically about global bioethics. So for example, Beecham, he argued, the foundation of global bioethics are independent of the norms of any particular culture, because foundational moral values transcend particular cultural values. The universality of these norms permits criticism of local action and practice that violates the norms, even if these actions and practices are dominant in the culture. Okay, so culture is not necessarily a right. These norms cannot be compromised without compromising morality itself. For example, the Afghanistan women being suppressed of their basic human rights. So this cannot be justified by their religious reasons. And then Professor Vich, also another important principlist scholars. We lost him just a few years ago in the pandemic. But he argued at the time, some systems that purport to be ethics ground their norms in nothing more than the norms of a social group, a country, ethnic group, or religion. These are not really ethics, ultimate underpinnings for standards of moral conduct, but merely social morals. Any true ethics, and therefore any true bioethics, must have universal foundation, that is, must be grounded in sources that apply to all humans regardless of culture. So now, ethics is higher than culture. And then he further advanced, I found this quite helpful in my, the last decades of research. He think, okay, for good ethic theory, you need to answer meta-ethics. You need to answer value theory. You need to answer virtue. But then the hope for global bioethics will lies within the principle of right conduct and how to make principle into practice. Okay, so he think for the fourth and fifth could be the cross-cultural consensus that is useful for global dialogue. But then there were different opinions. Okay, for example, Engelhardt, a closer examination of contemporary state of affairs reveals not only moral diversity internationally, but foundationally moral disagreement in North American bioethics itself. There are deep, persisting moral controversies, and the resolution of which, by moral argument, always presupposes a particular ranking of values, a particularly ordering of moral principles, a special moral sense, a concrete moral understanding of nature, or a particular thin theory of the good and rights. So you can imagine that probably explain the Downey and Common framework. Okay, you have commenting principles. And consequently, using rational argument for solving many substantive moral controversies is nearly impossible. Eventually, a canonical, content-rich, secular global bioethics cannot be justified. Its international imposition will be immoral. Okay? And then you have other scholars from Asia joining this camp. So, for example, Sakamoto, a Japanese scholar, okay, he thinks bioethics should be based on ethos, the way of thinking, and worldwide views, or worldview of people of respective region with the same cultural background. And then East Asia is a typical region. He thinks there's a hope to have our own East Asian or even Asian bioethics. There may be significant differences of contrast found between the East Asian ethos and American or European mentalities. Then, even so, for this special culture, they should still pursue harmony with other traditions. And then also I found this Professor Becker, his 6 ethical rules of East Asian society, quite interesting. Okay, even though he's a Jewish American, and then actually he turned into Japanese nationality a long time ago. And in his stay in Kyoto for a long time in Japan, he thinks there are 6 rules. Okay, firstly, interdependence over independence, hierarchy over equality, obligation over rights, others over self, harmony over confrontation. So if you protest, you probably better you resign. Okay, and stability of forms over changes. I'm not sure if that applies in Singapore society. Okay, we can check that data. Okay, then there's also a very influential paper, okay, because I checked its citation is like a few hundred, okay, so it's raping fun and offering to the Asian community too. He thinks there's 2 different incommensurable principles of autonomy. One is the self-determination, the other one is the family determination. Other things being equal, the Western principle of autonomy demands self-determination, assumes a substantive conception of the good and promotes the value of individual independence, whereas the East Asian principle of autonomy requires family determination, presupposes an objective conception of the good, and upholds the value of harmonious dependence. So then he simply said that, okay, we Chinese, we are this family determination, and for the Western people, they are the self-determination. So we have different arguments. I think they both provide some reason that appear to our intuition or our observation. But can we find from other resources that can help answering these questions? Let's check on the psychology researches. Okay, and I found this one quite interesting. Okay, it's Marcus and Kitayama. Okay, they are from social psychology, and their ideas is that culture and the self is relevant. Okay, and they make a difference between the two. Okay, and for example, they depict 2 different patterns of attuning to the social world and 2 different senses of the self or agency. People in different cultures have strikingly different construals of the self, of others, and of the interdependence of the two. These construals can influence and determine the very nature of individual experiences, including cognition, emotion, and motivation. Okay, so this is their theory. It's actually linked to your autonomy and philosophy. Okay, if your brain recognize yourself is something, This will influence the perception, cognition, emotion, motivation. And they will influence your daily situation and practice at home, school, and workplace. And then this will construct your institution and product like language, education, politics, and others. And eventually, it is ecological, economical, and historical factors, and both including deciding what is good, what is moral, and what is self. So it seems that it is giving our ethics opinion or tendency some biological foundation. Okay, so they have two different type of cultures. Many Asian cultures have distinct conception of individuality that insist on fundamental relatedness of individual to each other. The emphasis is on attending to others, fitting in, and harmonious interdependence with them. And American culture, as a representative, neither assume nor value such an overt connectedness among individuals. So they seek to maintain their independence from others by attending to self, by discovering and expressing their unique inner attributes. So then there are some descriptions about this. So we can see that you can see the first independent selves as individualist, egocentric, separate, autonomous, idiocentric, and self-contained. Okay, and if they make a figure, okay, the self is here, and the others just attach. Some are close, some are distant, even siblings. Okay, and after 20 years, okay, they make the picture, the figure better. Okay, he said that American culture, many Western European culture are like this. And the second type is the interdependent selves. So there are ways of sense of self as connected to, related to, and independent with others. And then you can call them sociocentric, holistic, collective, allocentric, ensembled, and so on. And quite often in bioethics, we talk about relational, okay, relational autonomy, relatedness. And by a figure, you can see that within this in-group, people are connected to each other, self, even friends, mother and brother, they are just intermingles. They are just cannot be separated. But if you are a stranger, then you are a stranger, okay? So for maybe the Asian social interaction rules is trying to establish this connection and try to enter the intergroup, in groups, then you will have the rights and privilege to do the many things. And these are the Asian cultures, African culture, Latin American, and many Southern European cultures. I think the Italian mafia is probably like this. Okay, okay, so please have a thought. Where are you? In this spectrum of the independent and the interdependent selves, okay? Are you A or B or C or D or E? Okay? So think about a few seconds, then please scan and answer the question. We have a QR code for you to answer these questions. Can you log in? Can you see the question? Okay, good. It's working, huh? This is a software developed by my colleague in electrical engineering. It's called Zuvio. Okay, Zuvio, if you know the Mandarin, non-Mandarin, the Minnan language, Zuvio means 触笔友. Zuvio. Okay, someone know this dialect. Okay, if you answered, we will come back to the result later. So I'll further these debates. So my colleague from the psychology department, K.K. Wang, Yang Guosu, they actually describe the Chinese cultural characterization to be familialism-oriented, relation-oriented, and then authority-oriented and other-oriented. And Professor Yang make a chart saying that for this familialistic orientation, you have family prolongation, harmony, solidarity, prosperity, honor, and panfamilialization, and also other definition. So I will not go into detail, and the theory was quite early. It's nearly like 30 years. And then let me come back to some empirical research I've done in the past few years, okay? For example, I've done some national survey of public attitude toward genetic testing. The case number is around 1,000. It was done in 2008 and 2018. Okay, and then we asked a few questions. So since the organizer very generously gave me 45 minutes, I think we can invite you to join this survey. Okay, please scan again. If you did not leave that scan, you can still come back. I will open these questions. Okay, allow me to open these questions. We saw there are 66 people answering the first question. Now I'm opening a few questions. I asked our fellow citizens about genetic testing for children. And when you have different opinion between parent and children, so what will you respond to that kind of situations? Can you see this question? If you answer the first question, you can continue to the second question. So there are actually two sets of questions. The first set is about genetic testing for breast cancer. That's for BRCA gene. That is actually a predispositional genetic testing. It tells you the tendency, the probability, but you don't necessarily develop breast cancer once you were tested positive. Okay, you might have a 85% rate of developing that in your lifetime. Is almost 20 times higher than the general population. Okay, and the second one is Huntington's disease, because this one is quite different. It's a diagnostic test. Once you have the gene, it will penetrate, and you will have this Huntington at your 40s or 50s. After 30 is possible, and you will die in like the 10, 15 years later. Okay, so let me go back to this question, and we have a quick go over of these questions. Okay, for example, Anna is 7. Okay, mother and auntie has breast cancer, and then if you are Anna's parents, will you take her to do the test right away, or later, or wait until she's adult and take her, or let her to decide when she's adult? You have these different options. So you can answer all these questions. So if you have finished that, you can raise your hand, so I can move on to. I will tell you the outcome of my national survey, and we can check what our participant today answer to that question later, okay, directly. So for these breast cancer risk groups, so Anna is 7, okay, and if you are Anna's parent, you would take her to get the genetic test right away. In 2008, there's 22%, but 10 years later, it's doubled. It seems to be parents in Taiwan became more paternalistic. More paternalism, okay? But this might be due to that over these 10 decades, genetic testing and the risk of BRCA, all those cancer genes are more aware, okay, by the general public, and you even provide testing at the health checkup, okay, provided by the hospitals. And discuss with her first and take her to test if she wanted to, 20% and 10%. And wait until she's of age and let her decide for herself, okay? So this is probably the ethically correct answer if we do this, okay, in the genetic counseling session, because you don't want to take away the right not to know of our children. You want to live in an open future choices, okay? So we will generally counsel, because this is of no immediate effect, you should not test your children right away. Okay, but we know that most of the parents, maybe out of anxiousness, anxiety, and then they worry, they were actually tempted to do the test prematurely, and even without the children's agreement. Okay, and then people respond to this. 60% think they should do that. If Anna is bigger, okay, and then she seems to have different thoughts, okay, in this adolescenthood, before adolescenthood, there's a youngster, it's quite painful for many parents, okay, there's quite often different opinions. So her parents want to take her to the test, but Anna did not want to. So our respondents say that 60% you would do that. Anna wanted to have the test, but her parents think she should not. But then 90% thinks, parents think you should do that, since she wants that. Okay, and most maybe inside her own opinion, his opinion, he wanted to do that. Okay, so if you compare the year 7 and year 16, you can also see it's quite similar, but still there were high level of parental decision over children decision tendency. And if you are a doctor, okay, and quite often, okay, the kids say, no, I don't want this. And the parents say, do it. I'm her guardian, okay, it's my rights, my choices. So you see that most of our participants, when they imagine they are a doctor, they will comply with the parents' request, okay, 50% to 60%. And then for the Huntington situations, if you are William's parents and you know that this is a very serious disease, there's still a very high rate of parents want to take the kids to test. Even they were told in the scenario there's no effective treatment so far. Okay, and this information might be a burden for the kids, lifetime burden. So you see that there are these differences even between the 10 years, but we can see increasingly, okay, our respondents, they are more aware of this kind of genetic risk, and they can be in charge of taking this the test and try to control the information. Okay, then there are other response that is quite similar. Okay, very high in doing the test and agree with the parents' request and not respecting the children's decision here. Okay, so this is probably reflects from the first the ancient joke. Okay, because I tell you to do so. Okay, then you follow my comments. Okay, and then for this one, okay, regarding whether children should undergo a genetic test for the disease, which is not urgent and without immediate medical benefit. So who should decide? We see that parent decide is not so high, and in 201A it reduces. Okay, when this is asked in a more general format, and you see that parent and children decide together after discussing. So we see this shared decision making. Okay, like Dominic's theory this morning. Okay, up to 50% believe this shared decision making is a better model. And then, since the families share the same gene, the result of the testing may also affect family members. How should that adult decide whether to undergo a genetic test? We see that you have over 60% saying that make one's own decision, but need to consult families' opinions. Okay, and there are still 30% of participants. They are the pure, independent, atomic members of the family. This is my choice. This is my choice. Okay, only 3 minutes. Okay, I need to hurry. Okay, so another survey in organ donation actually tell you in 10 years' time, this kind of individual autonomy was actually more emphasized. And family decision override the individual choices actually decrease in about like the 8 to 10%. Okay, so let me go back to some thesis by myself. We can see that the Western bioethic theory emphasizes the person, because they are self-consciousness, rational, and ability to value their own life, okay? And their wishes, because of these characteristics, these attributes, they should be respected and welfare be promoted. But I propose there are different type of idea, different concept of person. For example, I propose one two-dimensional personhood, meaning that you should have autonomous level of traits, but also at the same time, you have a relational person as your important element in you. And the self in Confucian thought is actually different, okay? Because we see that the boundary, similar to the theory of Kitayama, between self and other are not always clear. Family, community, country, and the world are spheres of self, okay? And even in the metaphysical sense, Confucian self search in unity with the Tao, the universal self, okay? So I propose in 201, there is this vertical dimension. This is autonomous self-cultivation 1, and also the horizontal dimension, the relational altruistics 1. And then you need to, at the same time, okay, consider these two dimensions for you to make choices better in this kind of society. So if we make a compare and contrast here, so what are values? It's a person's separateness, individuality, and distinctiveness, or a person's relatedness, mutuality, communion with others. Okay, like Hansen said in all the literature, Western theorists have understood the world as made up of particulars. Chinese metaphysical theories analyze objects apart, carved out of large, more basic whole. Okay, now we will try to come to this Asian value if applied to medical decision, even the pediatric decision. So the Western model may be respect for person, and you respect their autonomy, and you do the informed consent. But if you have a different understanding of person, then you will have this autonomous dimension and relational dimension. And for the left side one, respect autonomy is certainly informed consent. But if we like to promote the group welfare, okay, not only the person but also the group welfare, beneficence and do no harm probably will prevail in the ranking of these different ethical principles. So if we can see autonomy through Confucius, we can say that we see more agent with autonomy and dignity, but also concerns preferences and choices and rights to be practiced. And he is at the same time a relational being, and they are people in a context. When you do decision, you consider all this. So finally, I'd like to give you a very quick review. So what happened in the legal progress, okay, in Taiwan? In the earlier law, the Medical Act actually protect the right to know and informed consent, saying that you can tell the diagnosis and get informed consent from all these people. Okay, patient, legal agent, spouse, kin, interest party, and okay, they can all do consent in the surgery consent form. But then in the Paediatric Care Act 2000, it tells you that you can inform terminal illness to patient or her family members. But if the patient explicitly expresses the desire to be informed, and then she shall be informed. So for bad news, legally, okay, this law in 2000 protect the terminal patient to the right to know. Okay, and in the newer law proposed in 2016, announced, and then in effect in 2019, it actually tells you that a patient has the right to be informed of the diagnosis. The patient's legal representative, spouse, relative, healthcare, and other close related people may not prevent the medical institution or physician from acting on patient's treatment decisions. Okay, so meaning that family, you have boundary. If he make decisions, she make decisions, you cannot prevent what he has chosen and tell the doctor to do that, including life-sustaining treatment, including NG tube feeding when in PVS status. Okay, and then the medical institution or physician must inform the patient of the diagnosis. And in the absence of a clear objection from the patient, the party concerned may also be informed. So meaning that, okay, I have the right, I have my privacy. If without my permission, you cannot tell even my family, okay? It's only when you don't object to this sharing of information, and the family and the other party they have then could be told, okay? And then these are the relevant progress in law. So I come to some final reflection. So here, the task is actually quite challenging, okay? You want to put Asian value into medical decision and into pediatric decision. And you know that after 10 years, the parents in Taiwan, they don't care about children's decision, okay? The great majority of them just make the decision without any against or any objections, okay? So now we think there is something we need to do in this region. So we probably should think about, they are the psychologies, okay? They are the social self, the construal of self in different theory and ideas. And they might not be ethics, okay? They might be unethical. And then what it is certainly not equal to ought, okay? So we do not accept the empirical study telling you that most people think so, so this must be right. No, quite often people, the great majority make mistakes together, okay? And then for a descriptive ethics, the value cannot trump normative ethics, okay? And then in a more rigorous debate is the law. You need to go through a certain fundamental process and value. So quite often, okay, even in the ICCEC conference I just heard, the legislation prevails in many decisions. So if we go back to this cultural value in this area of thinking, and we want them to go together, go well, harmoniously with ethics, I think we should inherit respectfully. We should scrutinize critically, and then we need to transform creatively. Okay, thank you very much.
Thank you. Thank you for the insightful talk. We open the floor to questions. Does anyone have any questions? Or yes, please.
Daniel, thank you for wonderful lectures. I have one question. You described the change in their attitude, the cultural attitude about the some decision makings. But I want to know what do you think that drives the change among the people, or there may be some explanation for that change.
There are many theories. Okay, people are thinking we are not happy with the status quo, and we need something. I think there are a few legislation efforts. For example, the Patient Right to Autonomy Act, and previously the Hospice and Palliative Care Act. Okay, because we encounter lots of end-of-life decisions. We have lots of PVS patients. They continue to be fed by NG tube, and even with the prolonged mechanical ventilation support, life support. And that was a huge burden. Okay, not only to the family, but also to the national health budget. And then people think, okay, we cannot go too far, because the traditional law acts doctors the duty to rescue, okay, regardless of the resources and other reasons. And then the movement think that the right to a good death should prevail. We should give people these rights. So I think lots of bioethics discussion, medical education conference, even legal reform. It was not easy reform because it run 4 years, lots of consultation, lots of debates, and at the last moment, the law was passed, okay, to safeguard the individual right of autonomy. So I think from the medical community, from long-term care, from end-of-life care, and also medical education, ethics education society, they all involve the public to engage in this kind of a movement. So in fact, we can see the outcome. Okay, I learned from many like the end-of-life care, the good as ranking. Taiwan was making progress, just like Singapore. So I think that is probably one of the reasons. Oh yes, do you like to see the result of the vote? Probably I can show you very quickly, okay, before our next questions. okay, for the spectrum of independent dependent selves. 100% independent self is only 4%. 75% independent and 25% independent, 30%. And 50-50, about 40%. Okay? And independent one, 22. 100% independent, interdependent self is only 1. So we have brave people on both sides there. But at the normal is the middle, okay? And for other results, it's kind of complex. But you have seen the data in Taiwan. But in this audience, we see that, okay, take her to test is much less. Okay, so this is a quite ethical body knowing about testing and ethics. Okay, and then discuss with her, but then take her to 20%. Wait until she's of age and bring her. Okay, we have 50% of participants will respect the pediatrics autonomy. That's a good outcome. Okay, so I think I don't need to go further. The rest will be. Do you want to see anyone? Okay. How about the last one? Okay, the last two. Regarding whether children should undergo genetic testing for, which is not urgent. Okay. So parents decide very few. Parents and children decide together a little bit more, 20%. Well, until the children grow up, is 75%. Okay, that's good. That's good. Okay. And the last one about sharing information. Okay. Family members share the same gene, and how should an adult decide whether to undergo a genetic test? So make one's own decision. So you have 25%, just like in Taiwan. It's lower than in Taiwan. In Taiwan, we have 30%. Just they are the very independent themselves. And make one's own, but consult family's opinion. 74%. Okay, no one's of the rest. Okay, this is introduced result. Okay, so I'll stop the sharing here. Yes?
Yeah, thanks, Daniel. Back in the 90s, I wrote a paper defending testing for Huntington's disease in children. I think I was the one person who said let the parents decide in the Huntington's case. But I found what I think is the right course of action much closer to the sort of Taiwanese than the sort of American model. So I was kind of a little bit lost about whether you think there is a distinctive Asian set of values, because I think you can give defence for the Taiwanese attitudes to testing. For example, I think you can defend testing of children for Huntington's disease. But you seem to suggest, oh no, that's the wrong answer. We have to let the individual decide for themselves. So you seem to drift back to this Western approach. So I was a little bit lost at the end whether you thought there was a distinctive Asian approach, because you seem to reject the attitudes of the Taiwanese public, even though I want to defend them. And then to sort of adopt this kind of standard mantra that, people have to make their own decisions. So do you think there is the possibility of an Asian approach to these ethical issues?
Well, I do not intend to do that. Okay, and also when I was doing this research, because at that time there was this Human Genome Project ongoing, and people started to develop genetic testing, even make them commercialized. Okay, so there's lots of parents, they were tempted, and they will offer this kind of test for themselves, for their family, and they probably just very hastily select the test for their kids. Oh, this is important to see. I want to know whether they have or not, without a proper consultation, okay, pre-test counseling. And that is something even lacking today, when many countries they are doing this national biobanking, national whole genome testing, things like that. You're still lacking this kind of a counseling process. And this result is just showing that if you allow people just make decision by themselves, they could choose something that according to, maybe some international standard, these are quite immature, even unethical decisions. And Julian, you probably have a good reason, argue there are some good reason even parents to test Huntington for them, so they can know how many cards on their hand. They can plan how to play this card well. Okay, make the most of their life. But from lots of research, we also know that family member from this genetic disease, they respond to questionnaire. And a majority of them responded to, I don't want to know. Because that simply making my life turning from color into black white. So this right not to know probably is quite essential. Even Trump, you have many good arguments, and in many instances they could be better, but once he think, no, I have the right not to know, this is the right-based theory. He probably will argue this will trump all. But in Asian context, my point is that we need to protect more the vulnerable, even the children, because they are 10 to more likely to be put into this test without their consent, even against their will. So that will be how I interpret this result. I'm saying that, for this result, you are not approve them. You are saying that this is something you should be careful in you conduct testing, either for screening or for like the healthcare purpose. So need to be more careful.
Thanks, Prof. Tsai, for the very interesting and engaging talk. Just wanted to frame that question a bit differently. One of the concerns that we have of a broader, conception of autonomy is that problem of undue influence. Just wondering from the Taiwanese experience, how much influence is too much influence? And, practically in the pediatric perspective, how do you operationalize or, use the Patient Autonomy Act? Thank you so much.
Yes, that's important and also crucial questions. So when we try to provide a good discussion, good counseling, and people might question you, you are putting your value in this counseling, leading the parents or leading the patient to do certain decisions without really considering their value, their preferences. So that is certainly one possibility, and also quite tempting. For example, in the counseling of whether the mom is carrying a Down syndrome fetus, and in the counseling about the choices of abortion or not, is quite delicate. And then you need to be very careful. You even try to provide guidelines such as the non-directiveness, things like that, and you ask people to be trained in the counseling background to do that. But then we certainly will go back to more fundamental questions. Whether these values or these principles, they were actually coined, just based on these Western, maybe individual rights theories, and you don't really create them, based on a different concept of selves. So I think that will deserve some pursuit. Maybe forget about that, and then we sit down and we try to create some maybe guideline or consensus. So also will that be very different from the already established Western standard, or it could be different? And if that could be different, and when you compete, you compare them, can you really argue that, I win, I can override you? So I will imagine that could be a very interesting process of developing guidelines, and that you can claim, based on we have different idea of this interdependent self, society or nations, and then we probably can develop different guidelines.
Thank you. I think we have to call the session to a close. Let's just put our hands together for Professor Tsai.